We're at the Beebout Veterinary Medical Center, and I'm with Dr. Brandon Beebout. And if your pet's in an emergency, you want to get them to your nearest vet as soon as possible. And Dr. Brandon's going to speak to triage and what happens in the back.
Yeah, so that's a million-dollar question. Is you bring your dog in, whether it's I've been stung by a bee and I've had kind of an anaphylactic episode, even just really bad GI signs all of a sudden, and we're really looking terrible. We see lots of we've talked probably about hemoabdomens, blood in the abdomen, so a spleen that ruptures, the flipping of the stomach, GDV, seizures, all sorts of things. And so you bring your pet in. We rush them to the back. I know you want to be right there with them. We got to get them to the back because we got to get the veterinary professionals, the technicians, and the doctors on the case. And so what happens, because what seems like a lifetime in the lobby as you're sitting there, 10, 15 minutes go by twiddling your thumbs, wondering how your kid's doing. We're back there, we're getting, first thing TPR, we're assessing the mentation. TPR is temperature, pulse, respiration. So we're kind of getting the vitals on these guys. And then, many times here and veterinary clinics across the world, ERs and human medicine, of course, 2 or 3 of those come in at the same time. And so that may push the vaccine and the deworming or whatever to the back burner, and so that person may wait in the lobby a little bit longer, and that is okay for you. And we want to make sure that that is understood kind of in the community, that you may have waited a little bit longer, and it's because somebody else's pet was really sick. And there's even there's a pretty famous veterinarian in Hollywood, Florida, that wrote a big piece on this. It may have been in the Times, but just kind of relaying that information. And so when we haven't popped up talking to you, no news is good news is kind of our motto. And so we are going to put you in a room when we get the chance to make sure that everything's okay. We might be putting in IV catheters, maybe even intubating patients, those type of things. And so we can't leave to come talk to you just yet. Just understand that no news is good news, and we'll get in there and talk to you.
Because you want to be the one to talk to the pet's owner.
Absolutely. And so we may relay a technician or a front staff and say, hey, they're working on Fido right now, and we're going to put you in a room in a little bit. He's doing okay. And so we like to do little updates, but that's kind of the, it's always a question of how's he doing, how's he doing, how's he doing? And that's human nature. We love our pets, and they're in the back, and they're, they're sick, and so it's just something that's obviously on the top of mind.
So when you speak of triage, that means there's more than one emergency? What's the difference in definition?
So yeah, so they come in, and I did an internship specifically in emergency medicine in San Diego, which was great for experience. And now, now I'm in general practice and some orthopedics, everything is so much slower, and so the speed of the game is a lot slower, and so 2 or 3 comes in, and we say, okay, who's the sickest? Okay, this one, we need to get on oxygen. And so you two do this. And this one needs a fast scan and ultrasound probe to look to see if there's fluid in the abdomen, because we see really pale gums. And so we're doing a couple of those things. Then we kind of rank them based on our experience and our expertise to see, who goes first and then who gets in a room. And that's why we have the amazing staff that we do to be able to kind of tackle all those things at once. And it's a difficult thing, and that's why we work so hard, and we study and do all these things, so we're prepared for you guys.
So if there's a first step for a pet owner, give a call to make sure that you know that they need to come and see you.
Absolutely. Call if you're worried, and lots of people say, do I need to come in? If you're concerned, we're concerned. We may as well get eyes on that kid and get some vital signs and just go from there.
Thank you, Doc. Great information. Stay tuned next Monday for another edition of Pet Doc.